Hello everybody, this is Tommy from Capital Discount Nutrition. Today I wanted to talk about supplements that you can use for cardiovascular health. The first supplement is probiotics. We've done videos in the past on Primal Defense, by far one of my favorite probiotic supplements. There's 13 probiotic strains in here. Probiotics are really good and they're very important for our digestive system. We have about 5 pounds of bacteria in our small and large intestine and colon. So it's really important to take a probiotic, which is pro-life bacteria. That'll boost your immune system. That'll help displace the bad opportunistic pathogens, especially pro-atherogenic bacteria. So some of the strains in there like the Lactobacillus acidophilus, Saccharomyces boulardii, Bifidobacterium bifida, the Lactobacillus rhamnosus. These are great, excellent probiotic strains to take to more or less just balance out your gut microflora. It's really important too for cardiovascular health to displace those pro-atherogenic bad opportunistic pathogens. Then we have Pantothene. This is vitamin B5, the metabolically active form of vitamin B5. Pantothene has shown in research to have a positive effect on blood lipid levels. Especially it's able to raise HDL2, the good subtype of high-density lipoprotein, and then help lower LDL-B, which is lipoprotein, or low-density lipoprotein B, which is a subtype that's not good, it's easily oxidized, and LDL-a. Now you can get blood tests to have your lipids checked and to check out to see these different subtypes. You want to have HDL2, which is the good HDL, and you want to make sure you have LDL-a. These are both nice, fluffy, and buoyant blood lipids, and they carry the triglycerides and cholesterol to our cells and then back to our liver to be processed out by the bile acid. So Pantothene is really good to help balance out your blood lipid levels. So that's a really good supplement. Raw Resveratrol from Garden of Life. This is an excellent product. This is a powerful antioxidant. It's been in the news. You've probably heard Dr. Oz recommend raw Resveratrol or Resveratrol. Resveratrol basically will protect your cells from oxidative damage, and it's able to protect your cholesterol as it's traveling through your cardiovascular system to prevent it from being oxidized, because when it's oxidized, that triggers the immune system and causes the whole inflammatory cascade that damages your cardiovascular system. So Resveratrol, and this is 350 milligrams of raw Resveratrol that you can take, and these will all have a nice good synergistic effect, the whole being better than the sum of its parts. Next is no Flush Niacin. No Flush Niacin is probably the #1 thing to take for cardiovascular health. No Flush Niacin, similar to Pantothene, raises HDL2, the good cholesterol, and then lowers the LDL-B and the LDL-a. So no Flush Niacin is great. This is 6 molecules of nicotinamide adenine dinucleotide bound and surrounding 1 molecule of inositol to prevent that flushing effect. So if you don't want the flushing, no Flush Niacin, and this is at 500 milligrams. So that's really important because regular niacin you'll get about 100 milligrams. CoQ10, by far one of the most important vitamin-like compounds that you can consume. Very important. It's found in energy-intensive systems, especially concentrated in your heart and your liver. CoQ10 is basically an electron transporter, so it helps facilitate oxygen capacity within your heart cells and your liver. So it's very important to take if you're using statin drugs. That affects your mevalonate pathway, and that's going to affect CoQ10 production. As cholesterol is produced in the mevalonate pathway, so is CoQ10. So it's important to take CoQ10 to continue to keep your heart functioning at optimal levels in your liver and all cells in the body, especially your brain too. You know, your brain depends upon CoQ10 for energy transfers. So this is kind of like a mitochondrial optimizer. It's essential for health and it's essential for energy. Many people, if they have low CoQ10 levels and they start supplementing with a CoQ10, they'll definitely start to notice that boost in energy and they feel better. This particular CoQ10, we've done videos in the past, and you can check it out. It's 200 milligrams of raw CoQ10 with chia seed oil, and the chia seed oil is a carrier for CoQ10. So it's really interesting, the molecular structure of CoQ10, and having the chia seed oil in there is able to deliver it to the cells like your heart and your liver where it needs to be. DHA. We just did a video on DHA. This is docosahexaenoic acid. DHA is essential for the structure and maintenance of all cells in the body, especially energy-intensive systems like your heart. So this is essential for your endothelial cells, which are important for blood pressure, blood flow, and the distribution of smooth muscle to keep them functioning, especially your heart muscles. So DHA, this is algae, raw DHA. They grow their own algae in tanks, so there's no processing involved. They're able to feed the algae, so it's 50% oil, and it grows better than algae in the wild. So this is raw DHA, and this comes from Flora. Excellent product. And then, last but not least, the white chia seed meal. And I say not by least because, chia seed meal, you're going to need a good 2 tablespoons of chia seed meal. I'd recommend this every single day. Chia seed meal has a really good, interesting nutrient profile. It's a rich source of omega-3, alpha-linolenic acid, has omega-6 and omega-9 fatty acids. It's really good. It has soluble, insoluble fiber, which we're able to remove cholesterol, bile acids, and toxins out of your body. Fiber is essential for the normal functioning of our digestive systems. And if you look at our digestive system as a mechanical tube, it's there for capture, concentration, secretion, and absorption of nutrients. Well, things can get stuck along the way. So soluble and insoluble fiber is really important to just kind of get things moved along. And this is a gelatinous fiber too, so it's really nice and soothing for your digestive system, and it'll help just improve overall digestive functioning and colon health. Plus there's also vitamins, minerals, and antioxidants in chia seed oil, which makes it very unique. So I'd recommend 2 tablespoons of chia seed oil, or chia seed a day, and this will have the oil in there. So if you're ever wondering if am I going to be getting the omega-3 and 6 and 9 fatty acids, the answer is yes. And the same thing too if you purchase flaxseed meal. If you purchase flaxseed meal and you do 2 tablespoons, you're going to get the omega-3, 6, and 9 fatty acids, just like as if you were to take the oil. But plus, you also get the benefit of the fiber, which is essential for your cardiovascular system. Thank you very much for watching, and please visit us at capitalnutrition.com and hit like on this video if you like it. Thank you.